Good evening, everyone. Welcome to my show. Autumn is here. I'm your host, Francine Crawford. I believe the more that you know about people, the better you can serve them. Today, we're going to speak to Craig Azoff, who works with MJHS Health Services, and he also works with men's support groups. He's going to give us some insight from his experiences of men and aging. So let's welcome him to our show. How are you doing today, Craig?
I'm doing great because I'm sitting here talking to you, Francine. I'm doing fantastic.
Well, I'm glad that you were able to come on Autumn is Here. I'm glad that you are involved in different groups, different male groups. So please just tell us a little bit about yourself.
Sure. I'll start with what I do for a living, and then I'll tell you what I do for fun. So I'm the Senior Vice President of Health Plan Information Services at Elderplan and HomeFirst, which is the health plan side of MJHS. And my role is to lead. I have a department of around 40 people that I lead on a regular basis. Also at the job, I actually provide training and education on emotional intelligence to every new employee that comes into the organization. MJHS feels it's really, really important for employees to understand EQ and understand that emotional intelligence so we could support our members and our patients to the utmost possible way. For fun, I help co-lead a men's support group. I help facilitate men's transformational workshops, weekend workshops. And I also help staff father-daughter workshops with a good friend of mine. We started a company called Journey into the Heart, and we do father-daughter weekends where we help dads become closer in relationship to their daughters. Because I have two sons and one girl, and sometimes it's much easier for me to relate to the boys. And so, giving her chance so she can relate to her dad as well. So that's a little of my background, Francine.
Okay, well, that's great. That's great. We're interested in different things about aging and family and how families are involved with their parents and getting to know, getting their information and things like that. So we just want to talk to you, since you do lead certain groups, male groups. What are the things that may come up as their age, that things that are different that they notice and they talk about?
So throughout the course of, I would say, a man's journey, from a very young age, culturally, sometimes men are taught that we have to do everything for ourselves, that we have to be independent, that we have to be the ones to, support the family or to, be responsible. And as a man ages, and believe you me, I am aging. As a man ages, I've quickly realized I need support and I need help, and I cannot do it by myself. It's very, very difficult to go through this journey we called life with that burden on the shoulder. Like I have to be the one responsible for everything. So when we sit in these men's groups, or as I talk to other men, I've noticed that as we age and as we get older, our needs are very, very different. We go from maybe being really independent to being dependent on folks to assist and to help. And that could be a real blow to a man's ego at times. So.
Oh, okay. So how difficult is it for people to actually get to that point where they're actually talking about it, where they're comfortable talking about it? I can imagine that would be difficult talking about it.
Yeah, it could be really, really difficult to talk about it. And in fact, unfortunately, some men never get there. They never get to that place where they're comfortable talking about it. So for me, I could speak through my own experience. I've always been a little bit more of an extrovert and not afraid to talk and meet people and socialize with people. I think what our men's group does really, really well is the way we welcome men in and the way we upfront tell men whatever you want to say here and whatever you want to bring here is confidential. It's safe. It stays within this wall, whether it's the virtual walls of Zoom calls or if we meet in person. And really, it's important for a man to feel that he's comfortable and safe, both physically, psychically, spiritually, emotionally. That could be hard to get to at times. But I've discovered once you can get a man to feel that way, he will open up and he will talk, and then he'll realize he's not alone. And that just makes communication so much easier when he realizes he's got support.
Okay, great. Well, I know that you're not a clinician or anything like that, but what you're just talking about, which is like the emotional support, how do they take steps to allow their family in? Because this will help them as they're aging. And if somebody would have to take care of them, how do they get to the point where they are able to open up to their family in that way?
That's a great question. For me, it's about honesty. It is about a man looking in the mirror and being honest with himself. And so, if there's love in that relationship, if his family is close enough, I believe that a man could say, look, I really need to be honest here. I need to tell you the truth. And if he gets truth back and he gets honesty back, that could just grease the wheels for that kind of communication. Family could be hard. I know from an emotional perspective, if things get really tough for me, if they get really tough for me in the outside world, there are times that I actually could take that out on my family, right?
Mm-hmm.
Because I feel they're safe, because they're not going to run. And this is my perception. So emotional things that happen, whether it's at work or the office, I could go home in the evening and my kid could turn around and say, Dad, can you help me with the homework? And I can go, just, give me 5 minutes. And I could just really explode, and it has nothing to do with my child. So it's important to realize that we really need to speak to what's going on for us in those moments, so that we don't take it out on the ones we love or take it out on those, and we can have the deeper conversations with our family.
Okay. In your men's group, do they have certain exercises that they do that helps them to be more comfortable with expressing themselves? Is there specific exercises?
Absolutely. The men's group is structured in such a way that the first few rounds of speech are more high level, so that men could start to check in and start to build what's called a container. We call it a container. So that, and in a container is safe and it's protected on all sides and above and below. So we'll start with maybe an introductory question that every man can just think about. Then we'll do a check-in where it's just, give us your name, give me how you're feeling right now. Where do you feel it? Just a brief check-in, and we'll start to go around the circle and give men their space. No one interrupts any other man. They have the floor until they let you know that they're complete. And so we have several rounds like that. Later on in the circle, when men bring up things they really want to look at and they really want support around, we've got other structures in place, whether it's role playing, whether it's just releasing energy by, like a primal scream or whatever it is they need to do. We have structures that are built around that, so men can release those emotions, release that energy, and be safer when they leave our circle and go out into the world. Okay,
so you're big on emotional growth.
It is all about. So Francine, I call it like my science petri dish of life. So when I go to that men's circle, I will bring what's going on for me in the real world, and I'll say, hey, and just an example, like I had a real tough time with my boss today. Here's what was said. I got really angry, blah, blah, blah. And I'll bring that up. And then the men in that circle will help support me to look at what caused the anger. What was it about me that came up? Not my boss, but what about me? And so you start to learn about yourself in that process of, I get it. My boss said some things that made me angry, but here's what it was. And it was because my dad yelled at me a lot as a kid, and my boss was starting to sound subconsciously like my father. Whoa, well, I can't let that happen anymore. And I start to grow emotionally. I can start to do things that make me safe, meaning I won't blow up at my boss. I'll start to look at what my dad did, heal those wounds, and then move forward. And Dad, I love you. You didn't do anything to me. This is an example.
Well, it's interesting. It's interesting you talked about the father, did you say the father-daughter organization that you have?
Yes, father-daughter, sure. Mhm.
Okay. Can we talk a little bit about that? Because I think it's very important, especially as they age, your daughter may be the one that takes care of you. And it's good to get that relationship, building that relationship now. So how does that work? Tell us a little bit about that.
The daughters could absolutely be the nurturing ones in a relationship, and kind of assume the role of that caretaker. So for us, again, it's a little bit like the men's stuff, but my friend and I created this organization where we allow men and their daughters. The daughters can range anywhere from 8 till ? Or 10 till ? So it's a beautiful spread of how old the daughters are, but we create, again, this safe space for them to play together. So it's important for men to realize that you could play with your daughter, when they're younger. You could be in their lives in a very playful kind of way. And then as they get older, you can have the more difficult kinds of conversations. So we create space to allow those conversations to happen, where of course they're safe, they're protected. And I think as a dad of a daughter, I just remember my little girl. She's 22 now, by the way. She's not so little anymore. But when she was really young, she started playing baseball because I coached her older brother in baseball. And I think she thought that's how she could get daddy's attention.
Oh, okay.
And then one day she goes, "What about me?" And it just was heartbreaking and eye-opening. And so that's one of the reasons my friend and I created those kinds of weekends, to create space to talk to your daughter like she wants to be spoken to, not like you think you need to speak to her. And I think that's important for a man to realize. Really listen, and acknowledge her for who she is. So as a man gets older, I know and again, I'm not a clinician, I'm not a science guy, I'm not a doctor, but I know the brain changes, and I see it in older men, that are in our men's circles. But as the brain changes and sometimes the emotion and the moods change, it's important for the men to realize that this woman in their lives, their daughter, could really be there to support them, really be them to help them out and be an aid. And they need to treat them fairly and lovingly and the right way, despite all the changes they might be having in their brains. And that's important. Building it young, if it can build that relationship young.
Yes.
Like right now, my daughter tells me everything. She could tell me anything, and that's good or bad sometimes, Francine. Sometimes I go, "Oh, I don't know if Dad wants to hear," but because we have that, I know we're close. We may not speak every day, but she knows I'm there for her whenever she needs, and you better believe it's the other way around. I love her, and I know she'll be there for me whenever I need it.
Okay. Yeah. Building that relationship is great. And it's never too late to start building that relationship.
Never too late. Good words. Absolutely. It is never too late.
Yes. It's funny how I have friends of mine that come from a really good family, mother, father, and great people, intelligent people. And they're all girls, all sisters. And then their father got sick and nobody wanted to bathe him, because they thought they didn't have that kind of relationship where they thought that they loved him, but they were very uncomfortable. And one had to stand up and say, "Okay, I'm going to bathe Daddy," because he needed to help. But they felt very uncomfortable because even though they had a good relationship, it was the relationship of that was their father and a man, and they didn't want to do that. So,
that's a great point. That's a great point.
Yeah.
Yeah. The physical aspect of the relationship. It's interesting that part of the father-daughter weekend, we actually do hugs. We actually do different kinds of hugs so the dads and the daughters physically can feel each other. Because I know as I got older, my daughter necessarily didn't want Daddy hugging her and kissing her all the time. You know what I mean? She wanted her space. But having a physical relationship in a healthy way is very important also.
Okay. So are there any factors or concerns in aging, that aging is harder for men in different ways? Are there anything that you've come across?
I think for men, and again, I always will the caveat, I'm not an expert. This is all experience, but I think that one of the hardest things for men, and I could feel it for myself, is the physical aspect.
Oh, okay.
And again, able-bodied, we can go from playing sports and being competitive and, working, whether it's a physical job or even if it's a desk job, but we, get up, go to the gym, whatever those physical aspects are. But as we get older, those physical aspects start to wane. And I joke around with my friends. I'm in my 50s and I joke around with my friends about I rolled out of bed and all of a sudden my hip and my back. I'm like, what's going on? But those things they could take an emotional toll. And I'm joking about it, but no, there are times I'm like, uh-oh, is this the start of something? And that can take an emotional toll on a man. So the physical changes really could have a toll. I think intellectually, there could be effects on men. I know in some of the circles when men start to repeat themselves as they're older, 70s, 80s, did I say this already? And then everyone goes, yeah, you told us. And there could be this, moment where, they feel shame or they feel bad about themselves.
Yeah.
I think we all have to realize that those are phases of life, and we need to treat each other with compassion in those moments. And maybe the man in our life that's experiencing that, ask him to go see somebody and check it out, because it may mean something physical's going on that they need to look at. So those are two ways I think that as men age, it could take its toll.
Okay. So, what about any support groups or anything like that? Do you encourage certain support groups or certain, get friends around you? What would you speak to that?
I would tell every man to make sure you have support. I'm passionate about that. Make sure you've got, whether it's a group of really good friends that are not surface conversations, make sure you talk about real, make it real. And we might only have less than a handful of those in our lifetimes for people, but some of those are good. For myself, I found this group called the Mankind Project, where I run these groups, and that group is open all the time. Men can visit those circles, sit in that, feel what it's like to be in a group of men who are there to support you. That's important. Therapy, if it's not a group of people, the stigma around mental health in this country, no. Go to your therapist. In fact, Francine, it's really funny because when I teach emotional intelligence, I sometimes say that we could break this mental health stigma if we just, when a person is born, kid comes into the world, the doctor or the nurse slap them on the butt, they cry, the whole thing, they meet the doctor, then hopefully their mom's okay, and they meet their mom and dad is there, hopefully, and they meet their dad, and then they get handed to their social worker and they get to meet their social worker. And if everyone was born with a mental health professional at bedside and everyone had one, there'd be no stigma.
Well,
and we'd have someone to talk to. You know what I mean? We'd all have someone to talk to. Exactly. We'd be much more comfortable with it.
Right. Oh, that's great. Right. So I'm sure maybe, a lot of times maybe it's not true. I'm not a man, but sometimes they are harder to go to the doctor. There's certain things that you have to do, and especially as you get older, to take certain tests. It seems like they're harder to go to the doctor to keep up with that. How would you help that? What would you say to that?
I wish I had the answer. I tell people, if you're feeling something, you trust your body, your own body, right? And as a man, it may not just be a cold, right? You kind of know what's happening. Mm-hmm. I know there's a distrust sometimes with doctors, there's a distrust with the medical profession. There could be misdiagnosis. I get all of that, but it's important to go, because the earlier you catch something, the better your chances are. And so for me, it's just about constantly reminding men, hey, if you go see somebody, go to the doctor, do your annual checkups. Right. For myself, I discovered I waited, I was getting dizzy, not feeling 100%, and all of a sudden the room starts spinning, and I wound up with 190 over 100. I've been living with high blood pressure, and I wasn't really doing much about it, and boom, it took a bad toll, and I wound up going to an emergency room, and they thought I was going to have a stroke, yada yada. I'm on one pill a day, and my blood pressure hasn't risen in 7 years. So it's important if you feel something going on for you, men out there, please go, just get it checked out. And if you don't have a doctor, go to an urgent care. I know cost sometimes can be a factor, and that I don't have an answer for. Our healthcare system is what it is. But I will say that recently, whatever it is I preach, my son, who was 25, on his birthday, was having a medical episode. He was like, "Dad, my stomach, I've never really felt this way. I think I need to go to the emergency room." And I said, "I'm proud of you, just go." But he had dinner plans and with his friends for his birthday. He needed an emergency appendectomy that night.
Wow.
And if he didn't go, if he went out with his friends, right, and partied, who knows? Who knows if he's there the next day? So I was proud of him for going. And that's the message. Trust your body. And if your body's telling you something, go see somebody.
Now, I don't know, with your experience, do you encourage them or have you shared your information with your family? Like a lot of times when our parents get older, our family doesn't know our medical information, where we go to the doctor, if we've taken tests, what's going on with us. Do you encourage that for people to share their information with that person, that loved one, that spouse, that child?
Great point. I mean, I would. I don't know if I do it all the time. I have to be honest. I don't know if I do it all the time where I'm sharing my information. I think my children do know. I go to the doctor regularly. They know the doctor I go to, I believe, because I think, my son has gone to him when in New York. Whenever something's not right with me or they hear the stories, I tell them, hey, I went to the doctor for this and this, or this isn't feeling right. And sometimes they may go, Dad, all right, stop complaining. But it's important to share it. And so I would encourage that. You have to have a trusting relationship, but I would encourage, where's your DNR, where all of those things, living will, where my documentation, what's going on for me. Very important to share with someone you trust in the family. We all know if you wind up in a hospital and you can't communicate, you want someone there who knows what's going on.
Yes.
Because if you don't, the outcomes sometimes aren't all that good. So it's important to have people you trust who know your information.
Okay. So in your experience, is there anything that you come across that people should know, should do, that you would like to share, or maybe some misconceptions or something that you learned that you want everybody to know? Is there anything that you would like to share with the audience that can help others?
So what I've learned is, asking for support is not weakness. It's strength. Being vulnerable is strength. It's not weakness. And so if there's men out there that are experiencing anything physical or emotional and they feel they're alone, they feel like I can handle this myself, that there's no one that can help me, I will tell them right to their face, there's plenty of people out there that can help you. And if you're willing to be vulnerable and honest and share and ask for support, more likely than not, you're going to get it from some source. If you put it out into the universe will respond. And it's important to realize that is not a sign of weakness. It's a sign of strength. And I know for a long time, I had that I don't need anybody else kind of personality and attitude. And finding a group of men, talking to family, whatever it was, and being honest about what was going on and getting the support that's needed, I feel like a more full person. So.
Awesome. Well, thank you so much. Thank you for being a part of Audimus here. I appreciate your time. And the more you know, the more better it is for you if you're becoming a position that you have to take care of your parents, or things to look out for and to build that relationship. So it's good to be able to speak to someone and that engages with men in different situations. So, and you can express and let us know like how we can better care for them, how we can better understand them, and what they're going through. So that helps if at any time that we become a caregiver. So that's really
And-
good information. I thank you so much. I really appreciate that.
No, you're welcome. I would say for men who are scared to talk to the people that need to talk to, find a friend, find one of these groups. One of the things we do is we do practice conversations. And even if you don't find someone, if you're afraid to say it, look in the mirror and practice what you want to say and think about the response you might get, and then practice responses to that. So then you could go in front of the real person and have that talk. It's okay to ask for help. That's the message. It's okay to ask for help. It's okay not to be okay, and get support. So I appreciate you having me on this. Francine, I appreciate what you do. I've listened to several of your podcasts. Keep spreading the word. Blessings to you for doing what you do.
Thank you so much for your group and all that you do in support of men.
I appreciate that. Thank you very much. And I will continue my best.
Okay. All right. Thank you. Have a good evening.
Thank you. You too, Francine. Bye.